Today, human beings have been able to transplant almost every organ due to their constant effort and suspense of discovering nature. As a result, no one can prevent the spinal cord from being damaged, which is still considered the biggest disadvantage of head transplant. If a person's spinal cord is damaged, then he cannot feel any part of his body. For the past several centuries, the head transplant has been considered an extraordinary impossible surgical procedure. But in the 20th century, scientists began working on it to make the impossible possible. In 1908, Charles Guthri performed an experiment on a head transplant. They placed the donor dog's head on the recipient dog's neck. Charles Guthri failed miserably in his experiment. Then in 1970 another scientist, Robert White, performed an experiment on monkeys. The monkeys survived only a few days after their operation, maintaining their smell, hearing and motor functions. And then he died. The head transplant was also unacceptable on ethical grounds, due to which simple population raised many objections and raised questions. In 2017, an Italian doctor, Sergio Canavero, claimed this. He will soon perform human head transplant surgery in China, because the US government is not ready to support this surgical procedure in any way. Canavero also said that the Chinese government and Chinese Dr. Xiaoping Ren were with him, and that they would soon announce the date of the surgery. Canavero thought of selecting a patient with a healthy body as a recipient, but brain dead, while the donor will be a person whose head will be normal and disease-free. They will need 100 million to perform this surgery. And with that comes a large team of surgeons and specialists. And diamond blades will be needed to cut the spinal cord of donor and recipient. They will cut the recipient's brain and make it so cool that he will go into deep hypothermia and will survive immediate death. Deep hypothermia means lowering the temperature, a LOT. And this procedure will be done by seating the donor and the recipient. Because cutting and reconnecting vertebral bones, jugular veins, trachea, esophagus and other structures of the neck is extremely difficult task. This task may take more than 24 hours to perform. During this time, the recipient's blood will be pumped and performed through a respiratory action machine. The patient will be kept in drug-induced coma for some time. The doctor's biggest objection to Canavero was that it would cut the spinal cord nerves downstream, so there are negligible chances of it regenerating. In such a situation, we had to find a suitable solution. The whole world is against this operation. Doctors have a long list of questions. They need answers from Canavero. James Giordano, a professor of medicine and neuroscience in Washington. He said that despite so many studies, such a risky operation could not be allowed. He also wanted to know how to regenerate the spinal cord after Canavero operation, so they can support this procedure to some extent, but Canavero replied that he is a neurosurgeon, and he knows that the chances of this operation failing are very high. But by performing it, we can guess why its working is not possible. Valery Spirinidov, a citizen of Asia who suffers from a serious muscle disease, and the disease that caused him to not be able to perform physical activities. He wanted to be the first person in the world to give his head to another servant. Canavero met him and found out his opinion. Canavero delayed the surgery due to lack of equipments and finances. Meanwhile, Valerie got married and cut her name off from the donor list. This process was delayed and this surgery could not be done.